We're planning some big changes to the way we deliver mental health, alcohol and drug services to Western Australians. This will ensure we have the right types of services delivered in the right places to meet the demands of our state's growing population. There's an urgent need to reduce the heavy toll of mental health, alcohol and drug problems, and our suicide rate has been higher than the national average since 2006. We know that about 1 in 4 people over 14 are drinking at risky levels, and about 1 in 5 recently used illicit drugs. And with 1 in 5 of us having a mental health problem each year, that's a lot of people who need help to get their lives back on track. To provide this, our research and the people who need these services or work in these areas tell us we need to provide more services in the community, closer to where people live. Act earlier to prevent mental health, alcohol and drug problems. Involve people, their family and carers in planning and making decisions about their care. Give people more choice and control about the care and support they need to lead meaningful lives in the community, including housing.
I think it's absolutely critical that people are involved in setting their own goals and making their own choices in the recovery journey from mental ill health, along with their families, carers and supporters.
We also need to improve access to specialist care when people need it. It's also important that people with coexisting mental health, alcohol or drug problems get one-stop care, and that we improve mental health, alcohol and drug services for people in the justice and prison system. To undertake these changes, we plan to replace and refurbish our ageing mental health facilities and hospitals, develop specialised units for acute care when needed within our new hospitals, such as the Mental Health and Dedicated Youth Unit at the Fiona Stanley Hospital. We'll also establish short-stay facilities in the suburbs, closer to where people live, including step-up, step-down centres for subacute care and community-based clinics.
Well, it's lovely that Nehemiah is actually out in the suburbs. It offers a warm and comfortable environment where you don't feel like a patient, you feel like a normal member of the community. And it has really helped with my recovery journey.
Going from a place like this to going home, the transitions can be very difficult. So having a place like this that mimics what it is like at home, but still having the care and support has been extremely helpful for me.
Almost half, 43% of people in hospital for mental health problems in Western Australia could be discharged if more community services were available. In Western Australia in 2013-14, a mental health bed in a hospital cost $1,234 on average each day, whereas in a community subacute centre, it costs $453.
In WA, we've really relied on our hospital beds and our emergency departments, and this is where people think they have to go if they've got a mental health problem. However, if we can achieve what we want to, which is substantially enabling and uplifting specialist mental health care in the community, we'll take that pressure off the hospitals, off the EDs, and provide the care where people want to be treated, at home and where they work and surrounded by their family.
We are also planning to increase beds for acute mental health care in country regions. We're moving to provide easier access to services for people with drug and alcohol problems across the state. This will include a workforce trained in helping people who have mental health as well as alcohol and other drug problems, and the co-location of facilities and services where beneficial. These changes will require substantial investment over the next 10 years to build a modern and responsive system of care, where people with mental health, alcohol and other drug problems are respectfully supported to recover, stay well and lead meaningful lives in the community. We've set ourselves an ambitious agenda, and one that will require everyone to be involved, including the wider community, the private and non-government sector and the Commonwealth, to participate in the big changes that are needed.